to ask the First Minister how the Scottish Government plans to address reported shortages of antibiotics in light of the growing number of Strep A cases.
First Minister.
Medicine supply is, of course, a reserved matter. However, the Health Secretary has discussed this issue with the UK Government to seek assurances about the supply of antibiotics to treat Group A strep in response to the sharp increase in demand. It is advised that manufacturers currently have adequate supply of antibiotics in the UK, and wholesalers and manufacturers are working at speed to continually replenish stock. Scottish Government officials have issued a medicine supply alert notice providing advice to healthcare professionals on prescribing options, including alternative antibiotics if the first-line option is unavailable. In addition to that, work is underway to further strengthen the resilience of the supply chain, such as releasing antibiotics from medicine stockpiles, increasing manufacturing of antibiotic liquid preparation and, where necessary, importing additional supplies.
Rachael Hamilton.
I thank the First Minister for that answer. Just today, the Health Secretary claimed that there were no shortages of antibiotics here, and at the same time NHS Scotland said that a medicine supply alert was imminent. Doctors in my constituency in the Borders have described the situation as horrendous. Hospital staff and pharmacists have echoed these concerns, and chemists, First Minister, cannot even get hold of liquid penicillin to treat kids with sore throats. Does the First Minister accept that the Health Secretary needs to be more aware of the seriousness of this situation around the supply of antibiotics in Scotland instead of burying his head in the sand?
First Minister.
Look, this is a really serious issue. It involves the health of children, and I do believe all of us take that seriously, and I think we should treat the issue in that vein. Nobody is burying their head in the sand over this. Notwithstanding the fact, as I said earlier on, medicine supply is actually a reserved matter. It is not within the responsibility of this Parliament and Government. We do take our responsibilities seriously. The Cabinet had a very lengthy discussion this week on Strep A generally, but the issue of antibiotic supply in particular. The Chief Pharmaceutical Officer took part in that discussion. We are, of course, aware of some localised supply problems with penicillin and amoxicillin liquid preparations due to the increase in demand across the whole of the UK. But these types of demand shortages are not uncommon. The NHS has robust systems in place to deal with them, and the assessment right now is that there is sufficient supply within the UK to meet these needs. That said, though, where there are shortages of liquid penicillin, for example, that is why notices are put out about the alternatives that can be used. Solid form of the same antibiotics, or sometimes alternative antibiotics. And with alternative antibiotics, we do have the option of drawing down from medicine stockpiles. So these are issues of the utmost seriousness, and I would ask all members to treat them in that way. Everybody takes this very seriously, and we're all working hard and working together to make sure there is a good response now in the face of this rising demand.
Jackie Bailey.
Many parents from my constituency were in touch last week about the lack of antibiotics for their children who were suspected of having Strep A. One mother with a 2-year-old child had to contact over 20 pharmacies before their prescription was filled. At the start of last week, Humza Yousaf told this chamber that there was no problem with supply. But unfortunately, that is not the reality, and he was clearly confused, as your government have just issued an antibiotic shortage alert. Can the First Minister tell us whether Humza Yousaf was wrong? Will she outline what steps she will take to address these supply chain issues and reassure parents?
First Minister.
Jackie Bailey stood up there and acted as if she was giving information that was somehow new. I said in my original answer that the Scottish Government had issued a medicine supply alert notice, and we do that for a particular reason, and I'll come back to that. I've already covered it, but I will come back to that. Humza Yousaf has been and continues to be right in what he says here. There is no overall shortage of antibiotics, but in a case where there is a surge in demand, we will often, and not just in the case of Strep A, but in other situations, there will be localised shortages. But there are systems in place within the NHS to deal with that. And of course, where the particular first-line antibiotic for any condition may be in shortage, there are alternatives, and that actually is the purpose, or part of the purpose, of the supply notice, to advise healthcare practitioners if liquid penicillin, for example, which is the first line here, is not available, then the alternatives that can be used. This is the proper way of doing this. Everybody is treating this with the utmost seriousness. I come back to the factual point. Medicine supply is not within the responsibility of this government. Unfortunately, it is a reserved matter. We continue to work with the UK government, but we also continue to do everything we can to ensure adequate supply, and that is what we will do.